at that one for the forearm. We can add another one posteriorly. As you know, we have lymph nodes. We call it it's like a reserve lymph nodes. That means if you have a severe infection, the nodes be massively active. The reserve or the functional lymph nodes or the back, or the upper back will be functioning. That's why we can also apply lymph tape posteriorly if needed. Okay. Upper traps. This one is the most commonly used tape for cervical spine problems. And I always call the muscle problems. I always define the spine as a castle. Yeah? In the 15th century in Europe, they used to have, not even in Europe, either Saudi Arabia or Jordan or Lebanon, the castles used to have different lines of defense. First line of defense, this could be a water channel around the castle. It could be people with archery in the top, right? Or it could be other things. Our spine is a castle. We have three lines of defense. First line of defense is the intervertebral disc and its ability to absorb forces and disseminate these forces. Okay? But what happens if you wake up in the morning and you try to straighten your back up and you can't? Pain, buttock, thigh, and leg, classic nerve root problems. Or maybe neck. You wake up in the morning and you can't move your neck because your neck is stiff and you're having this nasty pain going down to your arm and forearm. That's mean there's something wrong happening, either in the joint or the intervertebral disc and the nerve root, maybe. That means the first line of defense is nothing. In this case, we need a second line of defense to be involved, which is mainly ligaments. I'm sure you know that we have too many ligaments around the spine. We have a short type, we have a long type, we have anterior and posterior, we have a lot of laterals as well. But the main problem with ligaments, they can't move in more than one direction. That means they are designed to limit movement. Let's say into flexion, we have posterior longitudinal ligament to limit flexion, to limit and guide. Then we have the small interspinous ligaments to maintain this kind of segmental movement between each vertebrae, the vertebrae above and the vertebrae below. That's why ligaments are not a good line of defense, because they are limited in movement. Straight away, they will ask for help. From who? Muscles. What's my point? My point, there's nothing called low back pain or neck pain because of muscle spasm. There's nothing exists called neck pain or back pain or spinal pain because of muscle spasm. Muscle spasm is a symptom, not a cause. Muscle spasm could be a tertiary or secondary problem, not a primary problem. And what does it mean in treatment? As I always say, when you treat your patient, you are like you are hosting a guest and you are offering him a meal, right? Appetizers, a main dish, and dessert. Yesterday I said table is a dessert. The soft tissue work, the 5 minutes nice soft tissue work, release, dry needling, or whatever that you do for the muscle is a must do. Because any patient with spinal problems, I'm not surprised that he will come to you with muscle spasm around the neck or around the back. Okay? But for us as a physios to consider problems of the lower back or neck is mainly muscular, unfortunately that's wrong. And if you receive a letter to say, referral, to say, please see this patient who has low back pain because of muscle spasm, that's nonsense. Always look for something inside. Is it okay? I'm giving you this introduction because with most of patients with neck pain, they will have this kind of muscle problems. Patient with muscle, mainly traps. Patient with shoulder pain, they also have this kind of pain and guarding around the traps. Why patient with shoulder problems? You will have tightness or overactivation. I don't like the word tightness. Overactivation of the upper traps. It's very simple. And I just make a metaphor that this area is like a family, right? So we're having head humerus, and then we're having the cavity. It's like a dad and mom. Then we have the rotator cuff. They are like the kids. Yeah? Supraspinatus, teres minor, infraspinatus, and subscapularis. If the dad keeps staying late and does not look after the kids, which means the head of humerus is just 2 millimeter translation, anterior translation, or inferior translation of the head of humerus, can massively disturb the activity of the rotator cuff. This means the kids, the rotator cuff, will misbehave. Correct? In this scenario, the bigger family, which is the anti-upper traps, rhomboides, the ankles, yeah? The scapular muscles, the big family, will start to interfere, and everyone is trying to make a decision on behalf of the dad. You know what I mean? Because the upper traps is the big auntie. She's always vocal, she's always talk, she's always taking control. Yeah? Same for other muscles. So how can we solve this problem? Bring that home. Yeah? This is what we do with mobilizations, this is what we do with mobilization with movement. But we can't bring that home without asking the kids to behave. That's why we have to activate the rotator cuff. Right? And also we have to calm down the big family and ask them to work on time if needed, not to work all the time. Does it make sense? That's why most patients with shoulder problems, I'm not surprised that the upper traps will be overactive. Can we use tape to inhibit the upper traps? I don't have any evidence for that. The only evidence I have is if we apply a nice tape of the upper traps, this kind of nice proprioception can decrease the symptoms or that can decrease the pain, right? As part of the bigger picture of treatment, which include rotator cuff activation, mobilizing the shoulder, right? And even looking at thoracic spine. Just brief introduction to talk about upper traps, okay? So we'll do a demo now for upper traps, but I will just look at other muscles and then we'll do a collective demo. So we can apply taping for upper traps, mid traps, or lower traps, as you can see. Ventroscopy, again, patient having neck pain, they will have some sort of tightness, not tightness again, sort of overactivation, because they might take this kind of forward head posture. That means they are elongated or asking the ventroscopy to be over elongated. As a response, it will be quite overactive or tight. So once you do flexibility tests for the ventroscopy and you feel some tightness or pain, I definitely will apply this nice easy tape for the ventroscopy. Okay? I don't have any evidence, and I don't think anyone taping the neck has an evidence for this or any other tape. My only reason for choosing this is when I apply this blue tape, most of the patients that we see, they have a problem at the cervicothoracic junction. Yeah? It's because simply we use C6, C7, T1 as a lower hinge. That means we ignore completely all the upper and middle cervical spine, and we just do the movement from the lower cervical spine and upper thoracic. That's why this area is always painful for a patient with forward head posture.
But against the always advises retracting and
Yeah.
moving.
Sort of, yes.
This is against this.
Part of it, yes. Part of it. Good morning. I missed you. And then this could be used to inhibit the extensors, which again, I don't have an evidence, but my evidence is we always know with forward head posture, the deep neck flexors are inhibited and long extensors will be overactive. That's why I apply taping for patients with neck pain, central neck pain. I'm not saying patient with peripheral nerve problems, patient with nerve root problems. If the patient coming to me with mainly posture, pain-related problem, I will consider these two. I might consider the upper traps or levator scalp. But I always ask myself the three questions. What's the problem? Can tape help? If yes, how can I tape? Good?
Sorry,
Shall we look at these three?
you can tape many muscles at the same time.
Yes. Yes. Yeah, you definitely can do that. And patient with whiplash, sometimes taping is the only thing I can do for them. In addition to education about movement. Because hands-on is no. So sometimes I can tape all these muscles. Or sometimes if there's any kind of trigger point or painful point, I put star tape, which I will do it now. So at the moment, I will do a collective tape for patient with localized mechanical neck pain. I'm very clear. Localized mechanical neck pain. Can anyone tell me please to be a moment?
Centralized undertaking. Mga radiating article.
Ano yun yan?
Centralized.
Ano? Check the screen.
What, sir?
Sir, traps or erector?
Hindi ko
Sir, erector or traps?
Together.
The one that you